Greetings and a warm welcome to those who have joined us. Let us give 2 more minutes as we can see several other people are joining. Thank you. A very good morning, good afternoon, and good evening to everybody, depending on where you are. I extend you a very warm welcome, Karibu, as we say here in Nairobi, to the press briefing today we have by CARE. Thank you so much for joining us at this critical time on this critical topic, deteriorating and worsening humanitarian situation in the Horn of Africa. I am Dr. Deepmala Mehela, Vice President for Humanitarian Affairs at CARE. I am the moderator for the panel and your host for the day. So let me take you through what's going to happen in these 90 minutes. We will start with a brief overview of the global hunger crisis, and then we will have brief presentations from experts in the sector who will talk about the humanitarian crisis, what is the context, what do all these numbers mean, and what can be done, what should be done right now about the Horn of Africa, and then specifically from Somalia. We should be able to cover this in the first 20-25 minutes, and then we would be open to questions from the participants for the day, and all of us, the panelists, are here to answer those questions for you. So in terms of housekeeping, please feel free to paste your questions in the chat as we go. And my colleague, David Mutua, who's the Regional Humanitarian Coordinator, would make sure that the panelists take the questions. And if there are any which we are not able to cover in this time due to time constraints, we will make sure we get back to you. So that is the plan. And without further ado, let me jump into the topic. Why are we here today? We are here today because the world is facing a devastating global hunger crisis, and this is happening in this world of abundance. We are talking about 50 million people just being one step away from starvation. And let me be clear at the start, this is a policy choice. People being left to starve is a policy choice. And the timing which we choose right now, as many of you already know, the biggest meeting of the World Leaders United Nations General Assembly is happening this week in New York as we speak. We want to again call out to world leaders, international community, and national governments to step up into this moment of crisis, because tonight, more than 800 million people are going to go to bed hungry. So I'm sure we all are aware of these various numbers, more than 800 million going hungry tonight, 345 million people facing acute hunger, 300,000 on the brink of starvation in Somalia. It seems that the word million is sort of losing its strength because we hear it all the time. The truth is, these numbers are real people, like all of us on this call and those who are not on this call. Real people, real issues who are facing hunger, lack of health services, lack of services related to water, sanitation, education, and the like. I want to emphasize a hunger crisis is not only about food. Mostly it is not. It is what we are facing now, the world is facing now, is a deadly mix of various factors, including conflict, climate change, rising economic prices, prices of fuel, gender inequality, social injustice, and all this has been exacerbated by COVID-19 and the war at Ukraine, because it is majorly disrupting the supply chains for food, food products, fertilizers, as well as fuel. I want to share two of my experiences. A few months ago, when I was in Afghanistan, I met women who shared that they are leaving their children to the mosque in the hope that somebody will give them somebody will give them food. These are women talking about their children. I recall conversations in Somalia where families told us that they have been walking for days and days, hours and hours, miles and miles, searching for food and water. On the way, they are having to bury their children and loved ones. The fact of the matter is, world leaders are failing their duty because economic and political interests have been prioritized over lives and well-being of the most vulnerable people, especially women and girls. This must change. Those with power and money to change this must step up, and the moment is now. As the Secretary General for United Nations said, we are in the 11th hour and the last minute of the 11th hour. The warning lights are flashing very, very high. And while we are talking, let me remind all of us, 2011, more than a decade ago, when famine was declared in Somalia, the world had said, not only said, but promised and committed that never again. And we are on the brink right now. And remember, in 2011, 250,000 people had died, and half of them had died before the declaration of the famine. There was a promise for never again. For the crisis that the world is now, there have been enough warning signals, a lot of them for over a year. Humanitarians have been raising them. And yes, we have lots of promises, lots and lots of them, and consistently. But promises do not fill the plates. Plans do not save lives. What we need is action. So we call upon world leaders, international communities, governments to step up, allocate immediate, flexible, multi-year resources so that we can deliver a humanitarian response to help people now, because the people in the Horn of Africa need for us to act right now and not later. At this point, I would invite one of my colleagues to share around the context and situation in the Horn of Africa. Justus Liku is the Senior Director of Humanitarian Response with CARE. He has more than 15 years of experience in humanitarian action, including response plan, design, and delivery. He holds many positions into external critical platforms related to food insecurity, including the steering committee of the IPC. And before I invite Justice Liku, I want to remind the listeners, please note your questions. We are very, very interested in them, and feel free to paste them in the chat. Colleagues and friends, I invite Justice Liku to share with us the context and the opportunities for the whatever time we have left while people are getting prepared to the 5th consecutive failed rainy season. Justice, welcome, and over to you.
Thank you, Dipmala, and a warm welcome to our audience. Our presentation today will be focused on the Eastern Horn of Africa, including Somalia, the arid and semi-arid lands of Kenya, and Ethiopia's southern and southeastern pastoral areas. These areas share same seasonal rainfall calendars and similar trends of acute food insecurity, as illustrated in the map displayed. As you can see, there are two maps. One depicting the period of August to September 2022, and the second one depicting the period of October 2022 to January 2023. It is anticipated that the hunger crisis will deteriorate further in the projected period of October 2022 to January 2023. So the situation as it is today, it is very dire, but as we move towards the coming months, we see the situation deteriorating further. The region is experiencing one of the most severe droughts in the last 4 decades. This prolonged drought follows 4 consecutive failed rain seasons since late 2020, which continues to push an increasing number of people into an alarming food and nutrition crisis. And based on the recent forecast, the October to December season is also projected to be below average, paving the way for an unprecedented 5th failed rain season, further worsening the hunger crisis. As you know, violence is also compounding the effect of the drought in some areas of Ethiopia and Somalia, and there is economic decline with high food inflation, resulting in reduced purchasing power for most of the vulnerable communities. These cumulative impacts of protracted drought, coupled with economic decline and food inflation, is causing higher outmigration, challenges of food and water access to hundreds of thousands of affected people who are in dire need of support, further exacerbating the humanitarian needs. I was in Somalia, the area of Galkayo during July, and at that particular time, actually, you could see lorries bringing the displaced people coming to the camps, one after another. At the same time, also visiting our health clinics, you could see the lines of queue for people waiting to get service, getting longer and longer each day. So we are dealing with very vulnerable populations who have faced layer on layer of climate shocks and almost exhausted all their coping capacities. Millions of their livestock are estimated to have died, and those remaining are weakened and emaciated and thus at risk. This is extremely alarming, as livestock is the main source of nutrition, notably for children, and the main source of income for the pastoral communities. Malnutrition and communicable disease outbreaks have surged as more people lose access to safe water, proper sanitation, and adequate food. And as I said, during July, I witnessed this live. Our healthy clinics with so many mothers with their children sick with different diseases, and malnutrition actually at its peak. Across the region, both men and women are eating reduced rations of food, which have left children under 5, the pregnant and lactating mothers, persons with disability, the internally displaced, and the elderly at higher risk of starvation. There are fewer decent livelihood opportunities, especially for women and girls, And now this has become a key driver of increased violence against children. We witness increased child labor. We are witnessing early child marriages, as well as increased gender-based violence. Children from the poor pastoral households who support their mothers in fetching water are dropping out of school, and at the same time actually at high risk of early marriages. In terms of numbers, at least about 36.1 million people have now been affected by the drought, which began in October 2020, including 24.1 million in Ethiopia, 7.8 million in Somalia, and 4.2 million in Kenya. About 1.9 million people in Ethiopia, and some 3.5 million people in Kenya, 6.7 million people across Somalia will likely face higher levels of acute food insecurity. And actually, and worse, famine has been projected in two districts of Somalia, as well as the high DPs. Okay. As I mentioned, displacement continues day in, day out, and at least about over 1 million people are displaced due to the drought, and the number continues increasing day by day. To address the hunger crisis, both immediate life-saving and long-term interventions that are multi-sectorial are urgently required. Whereas humanitarian funding has increased rapidly since July, especially in Somalia, the needs are rapidly outpacing the responses across the country, and therefore more funding is required to save lives and livelihoods. It's even better if that funding is more flexible, can be mobilized faster, and moved closer to the actors who are within the communities and can respond quickly to save lives. Nearly about $1.4 billion of new humanitarian funding is required urgently, with Somalia, which is mostly affected, requiring over $700 million, Ethiopia about $480 million, and Kenya about $180 million. CARE has long years of ground presence, providing humanitarian assistance in these areas most affected by the prolonged drought. And at this point, I will now hand over to my CARE colleagues and partners who are based in Somalia to tell us more about the situation, the response, and the challenges faced. Over to you back, Dipmala.
Thank you very much, Justice. Colleagues and friends, Justice Liku, Senior Director, Humanitarian Response at CARE. While listening to Justice, I was hearing the words deteriorating further again, and it cannot be emphasized enough that it has happened, the deterioration and the worsening of the context in front of the eyes of the world. And we are hearing about disease outbreaks, and as sad as it may sound, between starvation and death, there is usually disease. So there is a need for a multi-sectoral intervention, which means along with food, we need to work on water and sanitation and healthcare and other essential services. Since Justice has alluded to the very, very dire situation in Somalia, our next speaker is an expert and working in Somalia, Mr. Iman Abdullahi. He is a humanitarian and development expert with more than 24 years of experience while delivering emergency responses as well as early recovery and development programs. Iman is also CARE's country director for Somalia, based in Somalia. Over to you, Iman, and welcome.
Okay, thank you very much, Dipmala, and also Justice Liku for taking us through the global and also the regional level, what's happening and around the world in terms of the hunger crisis. Now, I really want to take you through what is the current situation in Somalia. And some of them actually have been mentioned by both Justice and Dipmala. And maybe just want to give you some figures specifically for Somalia. Approximately 6.7 million people across Somalia will likely experience high levels of acute food insecurity, that is IBC phase 3 and above. And this is what most likely will happen between October and December 2022. As just said earlier, we already had 4 consecutive rain failures. And also, again, we are predicting the 5th rain that's and starting next month to December 22 will be below average. So with that kind of projection, we think that about 300,000 will likely face a famine situation and conditions. And also, as just as already mentioned, we are already aware there are 2 districts in one of the regions in Somalia, that is in Baidawa and Burhakawa, that most likely will be declared a famine situation. And in addition to the extreme climate event, Somalia has also been severely impacted by Ukraine conflict, as already mentioned by Dimala. And this is actually affecting us in 2 areas, mainly on food. As you all might be aware, Somalia is a net importer of the cereals, especially the main staple food, that's wheat flour, rice, and cooking oil. It's actually said that 90%, of the food, the rice and cooking oil import comes from Ukraine. And we're also seeing that nutrition services that's normally supported by WFP have been impacted by the global supply chain crisis, and we are not having enough on the ground. In terms of the fuel, we're also realizing that the groundwater services have dried up almost 90% of the country, and whereby now we are really relying so much on emergency water tracking. And unfortunately, the water prices have skyrocketed as a result of the fuel increase. Moving to the next slide. Famine is actually knocking at our doorstep, because most likely, we're having the 5th rain failure starting in October. So as I already said, parts of the bioregion have been projected to be in famine situation. And we're also seeing access to water becoming increasingly challenging, whereby most of the water points have dried up and prices have skied. And also, I think the high yielding boreholes have also, kind of run out of fuel, and also they're working almost 24 hours the clock. Livestock have died in the hundreds of thousands due to lack of water and pasture. And the recent, FAO and update is by the end of this year, almost 3 million livestock death will be kind of reported. And I think this is a very high number of an animal, as you all know, that Somalia so much depends on the pastoralism livelihood. So, and also, livestock rearing actually forms the backbone of the most families' income. So that is really going to affect a lot. And we'll see that all the gains that have been made over the years will be eroded. And next slide. And what we are realizing actually currently is that the needs are outpacing the funding. I just wanted to share with you, in 2017, we had a severe drought, but luckily were able to avert the famine situation as agencies. And this was mainly because funding was mobilized faster and earlier. Just to give you some idea, in the first quarter, we were able to get 45% of the total contribution. And within the first 6 months, we were able to have 62%. So thereby we're able, to avert the looming famine. In the current 2022, yes, we have seen very good progress in terms of funding, whereby we are currently, having 70%, the human resource plan being funded out of the 1.45 billion. But still, a huge number of gaps are still there. And what you are really thinking, we really want the donors to urgently look into beyond the immediate needs. For this is important because the crisis is expected to extend and worsen since there's a likelihood of a lower than average rain expected in the short term, and there's need to address the root causes of the famine and make investment in recovery and resilience. Just to let you know, today I was actually having a very good discussions with the USAID team. And I think for a long time, the USAID team were able to bring together our emergency team and our developmental team together. And one of the things that we really discussed is how do we ensure that, we're able, to respond to this. And actually, we all reminded ourselves as we had a number of our team members who witnessed the 2011 and 2017. And some of us actually will also remember what commitment the world made to Somalia. As already said by Dimala, we say never again will famine happen in Somalia. But unfortunately, we're facing that in the next few months, unless we get an immediate and funding to respond to it. We also just wanted to share with you, Somalia is really suffering immense loss and also damage from climate change. And as you all know, actually Somalia is one of the countries that have least contributed to climate change, but it has been worse affected. The effects of climate change have resulted and definitely in reduced rainfall, also, lack of pasture and also flooding. And this is actually, the reduced rainfall has actually led to, crop failure and also, and also the animal deaths. So we're seeing the situation really, and getting worse. And the Somalia has been at the receiving end of this extreme climate change. And yeah, just wanted to share with you, CARE is on the ground to provide the much needed support. We are targeting to reach about 900,000 people who are drought affected individuals. And this 900,000 is about 15% of the people who are in crisis. So this is a good number that we are able to target as an organization. We are providing unconditional cash assistance to help families to buy food and also to be able to buy emergency clean water. Our care, health, and nutrition teams are responding to increased admissions of children with severe wasting and disease outbreaks such as measles and acute water diarrhea, cholera in the most affected districts. Just to conclude, I really feel that coming out of today's meeting with our USAID, both the BHA, the humanitarian assistance and development assistance, I'm seeing a bit of hope that we are all ready to make sure that we work on our resilience and our recovery and try to make sure we have a better collaboration between our emergency response and our developmental and programming. And with that, we all felt that we can still act, we can still have a chance to act now so that we can save more lives. I would like to end with something already said by Dimala. I think we really ask our donors and all well wishers to step up now. And we are saying the moment is now to save lives. And thank you.
Thank you, Iman. Friends and colleagues, Iman Abdullahi, CARES Country Director to Somalia. While Iman's talk brings in front of us the extremely dire situation, but Iman also shared with us some possibilities on how we can avert it. The humanitarians have done it before and we can do it again. All we need is timely resources and some enabling factors. Since we have spoken about the areas of Baidoa and Burakaba and the displaced people arriving there, where it is most likely that we would be seeing famine in the coming weeks and months. Our next speaker is an expert on the area and is going to share about the situation there. Mr. Alinur Ali Aden, he is the Executive Director of Gargar Relief and Development Organization, GREDO. Mr. Aden has an experience of more than 2 decades in a wide range of programs across several sectors, designing, implementing, developing, and measuring programs. And Alinur is going to share with us in some more detail about what is happening in the Bai area and what needs to be done right now. And before I hand it over to him, I again want to mention, please paste in your comments and questions in the chat, and we promise we'll come back to them. Alinur, the floor is yours.
Thank you very much, Mala and other team in the meeting. And good afternoon. I don't know, some people may be in the morning. Yes, I'm very happy to be part of this really discussion. I'm speaking here from Baidoa itself, where we have been really discussing about the situation. Nothing much to be added, because what has really said Justice and also Iman is the same what I'm going to say. The situation is really very, 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 very bad. And we are witness here. I've been here for almost a month. And the situation in Baidoa and Burakaba especially, it is very, really, very, very deteriorated. As you see here, the slides, we are talking about over 489 IDB settlements with a population almost very close to 1 million in just in Baidoa, not any other cities. Others also share that the same situation, like Hodor, Wajid, Dinsor, all main towns. But this is a hub for IDBs. People are coming every day by foot. Some people are coming from a very long distance, like 120 kilometers, 150 kilometers, 90 kilometers, 70 kilometers. You can imagine a mother with a children who just come from such a long distance because of just expecting to get service, humanitarian service to Baidoa in Baidoa. So Baidoa is now a hub because of access, and many people are expecting to get services, better life in Baidoa. That's why they are coming every day. People are coming every day. No transportation at all. It is really very, very bad situation. And I don't know what will happen. The most negative scenario that we are thinking is that what will happen for the next month. I mean, October, November, what is going to happen? If the situation is remaining the same, if you don't get enough raining, yes, if still there is enough raining, still adequate raining, still this kind of livelihood issues will be here. And until these people, and then which is we are expecting like end of January, even if rain is coming, if the rain is sufficient, the situation will remain the same. But maybe for the livestock, whatever remaining, it might be reduces the really the impact of this drought. This drought, I can say that it is totally different from the one in 2011, and it is totally different from the one in 2017. And all of them have been really here and witness what was happened here. For example, the one in 2011, in Southwest, only 3 districts was really affected. Dinso, Kasahdere, and somewhere in Kuntuwari. So now it is all the corners, all Somalis, even in Horn of Africa. So it is a very bad situation. It is very deteriorating. And if you see the number that he already close to IBC3 or IBC4, and some number who are all very close also IBC5, it is very worrisome. It is very, very really bad situation. And because of 4 consecutive rain failure, as the people already mentioned, water shortage here, even water, all the boreholes are dried up. Imagine for our office, we have been waiting for 7 days to get water tank here. So if I am lacking water in my office, you can imagine the mother, the children who live in the IDB camps. We are doing some activities for water tracking to the IDBs, but there is no water. So lorries have been really in a queue, maybe for a week, 3 days, 4 days. So that's the situation. The other contributed is also food price in the market is very higher, day by day, higher. Sorry, maybe the network has really cut off. COVID-19 pandemic, climate change, locust, and 4 years consecutive failure of rain has contributed all this problem. Plus, many of the districts in Southwest are under siege for almost 8 years, 7 years, 5 years, some of them. No district that you can have access. People are not using the roads, they are just using by air. If I want to send a supply to a district which is like 30 or 50 kilometers, I have to use the flight, not by road. So all this really has contributed all this problem. And also the situation on the ground and the response, it is not really comparable. The response is very less and the need is huge. So that is why even whatever we tried, there is still a huge gap. For HRB funding, which Iman mentioned, they are saying that 70% has been covered for the really need people. But what we are talking is just like very short term, like 1 month, 2 months, 3 months. So if a woman received care or other organization for 3 months, we cannot say it has covered the need, because after 3 months they don't have anything. Maybe some of them have already in a shortage. So this really very, very difficult situation. And I think we need to take very quick action. We are as a national NGOs partnering with the international organizations like CARE International, We are doing a lot activities here. We are trying to stop people coming from rural areas. We are targeting in rural areas, not in Town Baidoa only, in order to avoid people coming from long distance to Baidoa. But to reach that hard to reach areas, to reach that very difficult situation, we need a resource. So now it is the time that the donors, their good wishes, their diaspora, their business community to come up with a solution to mobilize their more or extra resource to prevent this knocking door or just away from steps to happen a famine. To avert that, we need resource. If you don't get resource, we can't do anything. As a national NGOs, as a local NGOs, we are ready. We are in front lines. Our team now are doing registration outside Baidoa, like 40 kilometers, 45 kilometers, 30 kilometers, to try to minimize the risk that people are coming to Baidoa because of searching water or unconditional cash. So that's the situation. That is the need. And that is what immediate response that we really request or ask from the donors, from the diaspora, from anyone who can contribute for this really ongoing efforts. Thanks the donors who have already shown their commitment, and also they are really generosity, like USAID, BHR, and any other donors. I think there's two things. Now we are talking about to prevent this most likely to happen famine, especially in Baidoa and Burakaba. But also we need to look at long-term solutions, not just to focus every day, every year for water tracking, NFI distribution, unconditional cash. This is not a solution for this community. The people who are talking about today from Baidoa and Burakaba, they are productive people. I know sorry, my connection. So these people they are very productive area. There is a farmers. They are the bread basket in Somalia in terms of sorghum. I have witnessed more than 50, 60 lorries with full of sorghum moving from Baidoa to Mogadishu market, then distributing to other regions in Somalia. Today, every lorry brings the sugar, veg oil, rice, whatever, and back to Mogadishu while it is empty. So you can imagine there is not really production here. There is no farm because of security, because of double taxation by IAS to the community, a lot of stress there. So people are just decided not to do anything, just come to main towns to get to look for a better life. So we need also to think if this drought to really minimize the risk of these droughts, we need to think also long-term solution. That one should be also one of the priority areas. It is very, very important to think about something different for what we have been doing for the last over 2 decades. I think that's not solution. We cannot always talk about water tracking. We cannot always talk about unconditional cash. We need to think something differently for the future, but not today. Today, we don't have any other option. We need to focus those who are really in need, those who are at the end of really farming. So that's the situation, and that's what we need, and that is what we need also to focus for the next future. I think that is my few remarks or presentation. Thank you very much for giving me this opportunity, and over to you. Thank you so much.
Thank you, Ali Noor. Ladies and gentlemen, Ali Noor Aden, Executive Director of the Somali organization GRADO. So while Ali Noor has painted a very realistic and grim picture of in the Bai region, he has also highlighted the life-saving interventions, and that's a very clear roadmap of what needs to be done for the upcoming famine to be prevented. Now, the situation for women and girls is even more grim. A recent study has revealed that globally, at least 150 million women and girls are more hungry as compared to men. And the reason is exactly the same for the fact that more women are in poverty as compared to men. Our next speaker is going to very briefly share about this impact of this grim situation on women and girls. Iman Ahmed is the Global Nutrition Advisor with CARE, and she has more than a decade of humanitarian experience. She currently works in Somalia and the Horn of Africa. She has also worked in Syria, Ethiopia, Kenya, Yemen, and several other countries on the topic of emergency nutrition in various capacities. So Iman will take us through how it is harder for women and girls, why, and most importantly, what needs to be done right now. Abhiyan, the floor is yours.
Thank you, Deepmala. Hi, everyone. So we can basically imagine the drought affecting everyone in the community at large, and that is basically what we see often. But when we do go down and narrow down to the effect it has on women, it is quite detrimental, especially for their children and for the future generation. So the obvious things that it does is it basically increases their workload due to male migration as they look for more opportunities outside of their areas of settlement. This means that women travel longer distances to fetch water. It means they have to work outside of the house more, and also it exposes them to many, many things, including sexual abuse and exploitation along those journeys. It also increases the risk of prostitution and early marriages as income diminishes. And we also know that in nutrition, women who are pregnant and lactating and children under 5 and adolescent girls have increased physiological and nutrition requirements. And this is often not taken into account. I mean, we don't really want to say that everyone is affected in the same way. Women are disproportionately affected by hunger and starvation. And the other thing it does is it negatively impacts on what we call the optimal child feeding practices, which means, you know, women have less time to exclusive breastfeed their children. They have less time to prepare nutritious foods as they look for work outside of the house. And they often tend to leave young children alone together because there is no one to look after them. And also this puts both the children and the women at risk of malnutrition. Women tend to, you know, take the responsibility for food and the feeding of their entire family. So in a situation like in Somalia now, where we know that food is a scarcity, you know, women will compensate the shortage of food by prioritizing the feeding of their younger children and their husbands. And this will put them at risk of malnutrition, as I said, because of their prioritization as well. Young girls, especially adolescent girls who are malnourished, have increased risk of early, termination or miscarriages. They also have increased risk to maternal mortality, stillbirth, and also children with lower birth weights, leading to an intergenerational cycle of malnutrition. Next slide, please. So, you know, as we know, drought also leads to livestock deaths, and in many rural pastoral communities, such as the ones that live in the Horn of Africa, this means that the majority or the main access of milk to children diminishes and decreases, further, exposing them to the shocks of the food insecurity. So, the other angle is also, when you have less hands on deck, you tend to send your children out to do some work. But often what happens in cases where we have seen in many countries, girls are deprioritized for schooling, putting them, at risk again, outside to work outside of the house, and also leading to, sexual abuse and exploitation. In Somalia, we have seen that there's been a 20% increase in drought-related sexual abuse against young girls. And this is one of the things that, we often don't see in the media, but women are hugely and disproportionately affected by drought. And it also leads to, the fact that there is a mass population displacement. There's an increased risk of communicable diseases that also lead to malnutrition due to overcrowding and lack of access to safe water, food, and shelter. Moving on to now the exact impact it has on nutrition and what it means for the Horn of Africa in general. We know that at the moment, the Horn of Africa is suffering greatly, and the situation, the nutrition situation has really exacerbated by the increased food insecurity, high disease burden, poor access due to conflict, and generally the poor caring practices and living conditions of the people. The countries that have been mostly affected are Somalia and Ethiopia and Kenya, especially the arid and semi-arid lands of Kenya, which the estimate now is 7 million children expected to suffer from malnutrition across from now up until the end of the year. This number has increased from 5.5 million, and it includes also 2 million, which are most likely to suffer from the severest form of malnutrition, which puts them at risk of death up to 12 times more than their counterparts who are normal and healthy. So we do see already alarming rates of mortality and malnutrition occurring in all the three countries. We have seen increased admission rates across those countries in the first quarter of 2022, and the number of severe cases have increased by up to 15% in the last 5 months, which basically means that in every minute, one extra child is becoming malnourished or severely malnourished and has an increased risk of dying without any intervention. And those who develop medical complications have also a heightened risk of death. And alone this year, we have seen reports showing 3 times as many children dying from medical complications in health centers or inpatient centers compared to the whole of the last previous year. So the situation is really bad. I can't really stress how bad it is. In Somalia specifically, where famine is projected to happen in this quarter coming, and we have already seen very, very alarming rates of malnutrition as well as emergency level of death rates. Northern Ethiopia and generally southeastern and south of Ethiopia has also seen really, really bad levels, specifically in the Tigray region, where we see women who are malnourished, and the rate is really extremely high. We're talking about 1 in every 2 women who are pregnant lactating being malnourished, putting their lives both at risk and as well as their newborn. So with the increased displacement in the region in the coming few months and the water scarcity due to the failed rains and the disease outbreaks, as well as reduced humanitarian access, we do expect the malnutrition situation to further deteriorate well into next year as well, if we don't act now through a collective and responsive humanitarian packages. So in terms of the way forward, we know that we are currently seeing serious gaps in the provision of life-saving treatment services and interventions in wash and food and vaccinations. And many millions of children and women are taking desperate measures to survive in the face of this extreme hunger. Therefore, we need to have a rapid scale up and coverage of these services to prevent excess mortality amongst children and women. We also need to improve accessibility in areas where we have issues with humanitarian access. We also have extremely high food insecurity in many pockets. So supplementing the diets of those most vulnerable and promoting maternal, infant, young child feeding practices is of our main utmost priority. And we focus on nutrition, but we really need to think about more sensitive programming, nutrition sensitive programming, targeting those who are most vulnerable, including women and children and adolescent girls. So I honestly call out to all the donors to increase funding, not only for short-term, but also for medium to long-term interventions, and also pre-position nutritional supply in the region, so we can act and scale up much quicker than what we already are doing. I think that is all from me. I'll give the floor back now to Deepmala, and thank you very much for attending today's briefing.
I think Deepmala is having some problems with with her internet connection. So we will move next to a brief video of one of the individuals in Baidoa who is currently displaced in a camp. And for 1 minute, we'll just hear what she has to say, and then we will open this up for question and answer. Over.
Pile sanoliere sanade kontong ya farsano ula tesi edani el bong ya ko pai ma ada makahok anak kahin beri hola le kanola ni mang tukang makara mana hola gini no amare berti no abar sati eno ko beteng na furi duk kalian ni hai besi siang asuran na rai sa numer ku senan malahan ula jiring ha to hare sini geber te dadi sim biara jita ono kedili Meli datang halu kaya ni, kau ini tentang apa ni ada. Kau pun suka sih bukan ada ni suka ni sini eber gol balik. Kajian teman afas. Hei dah sama falka, laki bol bun itara kor. Aku sampah hang na. Kol ba ada makam, kalau lu makam orang guru leka karsa sofia ada makam uni return lek orang ni bapa pun mahara. Halu kaya ni kau ni le. Illa siat beri jita kejar.
Thank you very much. Now it is time for questions. Maybe I would request David to remove the PowerPoint slide from the screen so that we can have better interaction. So I will start with the first question that we have received. The question is to know more about the double taxation situation which the community members are facing in Baidoa. For that, I would invite Alinur from Grado. Alinur, can you please expand a bit on the double taxation issue in the Bai region?
Yes, thank you very much, and thank for that question. Yes, for the mother has also mentioned that clip. If you just read it, or government or federal member state are controlling, taking or opposing double taxation. They have been asking to pay a taxation which they cannot afford when they are just cultivating lands, when they are doing the harvesting, and even there's monthly fees for every hut. This is traditional house for the rural areas. Every hut or every house should pay 500 Somali shillings, which is like almost $3 per month. And then by every year, and then whatever they produce, there is a taxation also. So there's a lot of different taxation by AS. They have been doubling for the last some years. Every year they're increasing. So that the pressure coming from that also. One of the reasons that people have left out to do their farms, even that's also one of the reasons. Because if they don't benefit, so even they see that it is nothing for them to do the farms even. So that's why one of the factor has contributed. People moved from the areas to main towns even. So that's a double taxation I say. Thank you.
Sure. Thank you, Alinor. Our next question is about the education for girls. The question is, what measures are we taking to ensure that the education for girls is not disrupted once they move into the camp for internally displaced people? I would invite Iman Abdullahi to tackle that one. Iman, can you step in briefly to cover that, please?
Yeah, thank you very much, and Dimala. And I think the situation that we are seeing, actually not only the IDPs, even the host community, whereby girls, are dropping out of school. And as already said, by Abian, in a situation like this, whereby a family maybe who have about 3 boys and 3 girls, what they normally do in such a situation where they don't have enough to support, they will always prioritize for the boys and leave out, the girls. So what we are doing as organizations that are working in the education sector, we are actually focusing on such families and also the people who are the IDPs to ensure that, we give scholarship specifically for the girls so that, they can remain in school. And also, we are also working in a way with World Food Programs, especially when they have the supplies to support us on school feeding program in the schools where we are working. So that's also another way that will ensure that the programs go on. Education goes on for the girls. The other one, even in the long-term and programming that is normally funded by and by the main donors, they have allowed us to do a reprogramming. For example, in a situation whereby we realize that and there's lack of water in a school, and the schools cannot afford to buy the water, we support them through reprogramming of the funding to do water tracking. And that has really helped us to have our girls and even the boys to stay in schools. Thank you.
Thank you very much, Iman. Our next question is around the humanitarian and hunger situation in South Sudan and Sudan. I would invite Justice Liku, who has more of a global overview. Justice, would you step in to articulate about what's going on in South Sudan and Sudan briefly, please?
Thank you, Dipmala. Yeah, in our discussion, we didn't focus on South Sudan and Sudan. We narrowed our discussion to the 3 countries, Kenya, Somalia, and Ethiopia. But also these countries, Sudan, South Sudan, which are also in the Horn of Africa, are equally affected by the global hunger crisis which we are experiencing. Sudan South Sudan, actually, let me start with South Sudan, which is also facing like similar circumstances on what we are seeing in Somalia and what we are seeing in Ethiopia. And actually having some populations also which are approaching the famine situation. The issues here again being that conflict is one of the major drivers, which we have witnessed, especially in the Jonglei and the northeast counties, where we are witnessing conflict resulting into displacement, people not able to, not able to put their labor into their farms and not able to produce enough of what is required locally. So we are witnessing a deteriorating situation. Again, as we have mentioned, what has happened in Ukraine, Russia, the war there, in terms of disrupting the supply chains, it has seen those countries not being able to, for the vulnerable communities, not able to access enough to feed their families. Let me give a specific example. Even we know that cereals like wheat, much of it comes from the Russia-Ukraine region. But actually in South Sudan, much of the cereals consumed is mainly sorghum and mainly maize. But what is happening? Because of lack of wheat in some of the neighboring countries, Kenya, Uganda, then they have resorted to, consuming maize and wheat. And therefore the exports actually, which used to go to Sudan, have reduced, and which are impacting them, even if wheat is not their main staple food. But what they consume, and especially coming from the neighboring countries, they are getting less, and that is impairing access to the food required in those countries. Moving to Sudan, I think we have experienced also different challenges there. There has been some political tensions resulting into some conflict, displacement. Again, Sudan also, consumption of bread from wheat is one of the main staple food. Again, importing some of their products from the Ukraine and Russia area. And this has impacted access of some of these main staple food within the region. Again, also the drought aspects, the rainfall aspect is also affecting some of the places in Sudan. And that, therefore, that is also impacting on the hunger crisis. So let me say huge numbers of IPC 3+ in South Sudan, and actually with some of the areas with some populations in IPC 5. And also in Sudan, very high population levels in IPC 3 and IPC level 4. In other words, let me conclude by saying that assistance is required urgently in these particular countries because access to food is below what is expected. And also we have witnessed the malnutrition levels in the two countries also going up. So assistance is required not only for the 3 countries we are focusing on, but also these other neighboring countries, which are equally affected. Over to you, Dipmala.
Thank you very much, Justice. Friends and colleagues, we are coming towards the end of our briefing. So towards the end, I want to make 3 calls to action. The first one is to world leaders, international community, and national governments to allocate resources urgently, resources which are flexible and which are multi-year, which can help us scale up a multi-sectoral response. The second one is to all the partners and colleagues in press and media to bring the spotlight and the attention to this critical and massive global hunger crisis. This topic needs as much attention and as much spotlight as possible. The third one I want to reiterate, humanitarians need to be able to reach those who are most vulnerable. Humanitarian access consistently and safely is much needed. We will be more than happy to discuss organizing visits to the specific areas and taking further questions, queries, and interview requests. You could contact David Mutua, who's our communications manager in Eastern Central Africa, based with me in Nairobi. You can see his contacts in the chat. With this, I sign off. This is Deepmala Mehla, CARE's Vice President for Humanitarian Affairs. Have a good rest of the day, and we are together in this.